Goose is a 8-year-old quarter horse gelding, and I've owned him for 1 year. I bought Goose not wanting to do his job. He would stand up behind the barrels and he refused the alleyway. We went slow and he started to come around and started to do his job. Goose was warming up and he proceeded to cough. We took him back to the trailer. We did our regular routine maintenance that we would do. I ran him in. He ran a good pattern with no run home. And when I came out, he was breathing very hard underneath the saddle. So I got off quickly. I released the cinch and I started to hand walk him to make sure he was okay. When he was struggling to breathe, we brought him immediately to the vet and we tried to put him on antibiotic and antihistamines, and that did not fully fix the problem. So that's when we saw Dr. Emily.
My name is Dr. Emily Setlakwe. I'm an internal medicine specialist at Tryon Equine Hospital. So I'm board certified in internal medicine for large animals. I would say that I probably see at least 1 or 2 asthmatic horses a week. When clients bring horses to me that end up with a diagnosis of equine asthma, most of the complaints are usually related to poor performance, so exercise intolerance, horses that breathe hard, breathe rapidly during or immediately after exercise, cough, essentially a horse that just can't complete the task at hand and has a decreased quality of life. Before Goose came to me in July, he had been treated with a plethora of treatments, including inhaled steroids. I believe he had been receiving inhaled dexamethasone, oral dexamethasone, oral prednisolone, oral clenbuterol, as well as a variety of antihistamines with no improvement in his clinical signs. After I definitively diagnosed him as severe asthmatic, we switched him to the Aservo EquiHaler to better manage his symptoms.
The Aservo inhaler was very simple for me to use. The directions come in the box. Goose was a little unsure the first couple treatments, and then once he realized that that was something that was going to help him breathe, he stood there perfectly.
I chose the Aservo EquiHaler for Goose because as the only FDA-approved inhaler for horses, it's highly effective. It's deposited straight into the lung. We see a lot less systemic side effects. And so that was definitely my preferred treatment over all the other options that had not worked in this case. Most of my patients have been able to go back to regular work and overall have had improved quality of life.
It's a game changer in my opinion. Without it, I don't think Goose could honestly go back to work. His breathing was so lagged at home, he wouldn't go forward, he couldn't breathe. By having the Aservo inhaler, it's allowed me to ride him, compete him. He's honest as they come now. He loves his job. Goose is amazing.
Important safety information. Aservo EquiHaler has not been evaluated in pregnant or lactating mares. In a large clinical field study, the most common adverse reactions reported were coughing, nasal discharge, sneezing, and nasal irritation, bleeding. Concurrent use of other anti-inflammatory drugs, such as non-steroidal anti-inflammatory drugs, NSAIDs, or other corticosteroids, should be approached with caution, not for use in humans. Keep this and all medications out of the reach of children.